Welcome to the Adoption and Foster Care Journey, a podcast to encourage, educate, and equip you to care for children and youth through adoption, foster, and kinship care. Hosted by an adoptive mom with over 22 years of kinship and adoptive parenting experience. She's on this journey with you. Please welcome Sandra Flach.
Jesus replied, "You must love the Lord with all your heart, all your soul, and all your mind. This is the first and greatest commandment, and a second is equally important. Love your neighbor as yourself." That is Matthew 22, verses 37 through 39. I am your host, Sandra Flach. Welcome to the Adoption and Foster Care Journey. I am honored that you tuned into this podcast, where I hope to encourage and equip you for your parenting journey. As a mom of 8 myself, 5 through adoption, all with trauma, including 2 diagnosed with fetal alcohol syndrome who are now young adults. I am on this journey with you, and I personally know and experience every day the challenges we face with raising children with trauma histories and prenatal exposure. So my hope is that you will find this podcast an invaluable resource for your journey. So this week, I'm so excited. We're continuing our nutrition series with Dr. Jerrod Brown, and we will be discussing, nutrition and FASD. Last week, we kicked it off with nutrition and as it would apply to trauma, and how individuals or children who've experienced trauma, how vitally important nutrition is for them. And this week, we're going to zero in on FASD. So Dr. Brown, just as a reminder, will be presenting with slides. So if you want to see the slides, you can go to the Justice for Orphans YouTube channel and watch with the slides. So you can just listen now as a podcast and go on later to see the slides and kind of watch it through a second time, or just go right over there now, whatever works best for you. And we will have a link in the show notes to our YouTube channel. It is the Justice for Orphans YouTube channel, where all of the video versions of this podcast exist. So you can find that there. And before we bring on Dr. Brown, just a reminder, my new devotional book, Soul Care Saturday, 52 Devotions for Foster and Adoptive Moms, is now available on Amazon. And this month, you will have a chance to win a free signed copy. All you need to do is register. There's a link in the show notes where you can go on and register. It'll just ask you for your name, your email address, and your mailing address. So if you win, I can send it to you. And at the end of January, we will be pulling 2 names, and those 2 individuals will receive a signed copy in the mail. Here's a little story. And because I'm recording this particular episode right before New Year's, I'm actually recording it on December 29th, getting ahead of myself. Story about my book. I still haven't seen it in person. It isn't in my hands yet. It's torture. I ordered my book. Well, as an author, when you publish through Amazon's KDP Publishing, I self-published, you can order what they call author copies. So I can order in bulk, kind of like ordering wholesale, but it takes 3 or 4 weeks to get that shipment. And I ordered a shipment of 500 books because I need them for the end of January when I start traveling and I go to Field in Pennsylvania. So I knew that was going to take longer. So I went on to Amazon just like I do to order anything else. And I ordered my own book, ordered and paid for it full price, just so I could have a copy in my hands. And I ordered it the first day it was available, which was like right before Christmas. It was the Monday. I don't even remember the date now because I don't have the calendar in front of me. But so the Monday, at least 10 days before Christmas. Let me put it to you that way. It was supposed to arrive the Friday before Christmas, so it would have come in like 4 days. And then I got notice that it wasn't coming until Saturday. fine. I'm busy with Christmas preparations. Then it wasn't going to come until Monday. And then on Monday, I was notified that it wasn't going to come until the 24th, New Year's Eve. And I'm like, there's no way that that book is going to show up on New Year's Eve, but we'll see. And I kept tracking it. And it was sort of just sitting in New Jersey for some reason. It's set in South Carolina and then it's set in New Jersey. And I had like no hope that it was going to even come in time for Christmas. And it didn't. And of course, the day after Christmas, we pack up everything and we head up here to the mountains to our camp, where we were going to, we're spending some time. And so it arrived. I left on the 26th to come up to our camp, the 26th of December, and it arrived on Saturday, the 27th. So it sits home on my counter and it's still not in my little hands. Now, by the time you're listening to this, because we're releasing this episode on the 12th, I will have seen it and had it in my hands. But I just want you to know, I had friends across the country texting me pictures of the book because they had ordered it, and fellow adopted moms, they ordered it and they got theirs and they were so excited. And I was like, oh, yay for you. I don't even have it yet. So just a little torture there. I don't know if it's spiritual warfare or what it is, but I was like, I cannot believe, everybody else is getting this book, and mine, out of all the things, everything I ordered for Christmas from Amazon came on time, except for my book, right? So I don't know. There's just a little story about, that's how things go. So as I digress into that, for some reason, I just wanted to share my little sob story with you. Wanted to let you know, make sure that you register for your free copy of the book. I won't have copies to sign and send out until the end of January because I won't get those until then. But as soon as I do, you'll be getting your copies if you win. And let's see, what other announcements do I have? Make sure that you check out our website, where you can go to justicefororphansny.org, link in the show notes, and click on the adoption and foster care journey, and you will see all of our things, from our bonus episodes with Dr. Jerrod Brown. Our episodes of this podcast are all there. To sign up and learn more about our FASD, Hope for the FASD support group, different trainings that I've done, our upcoming trainings that you can sign up for, all of the resources that I have for you, including my blog. I blog monthly. All of that is there. So if you want more information and more content, you can go to our website. You'll find that there, as well as Dr. Brown's lengthy bio. Instead of me reading it the whole time on each podcast, I'll give you a little snippet. And then if you want to really check out his entire bio, it is there on our website as well. So lots of things going on. Make sure that you go over to the adoption and foster care journey on our social media pages and like and follow us there. We're trying to build, that base there so that you're seeing everything new that we're posting. That we always post about the podcast and some quotes and some different things and the trainings that are coming up and all of that. So you'll want to follow us there. We're on Facebook at the Adoption and Foster Care Journey, and then we're on Instagram at AFC_journey. So I hope to see you over there. I also hope to see you in person this year. So the first half of the year, the spring quarter, I've got some already booked events that I will be at. So I will be at the Filled Retreat in Lancaster, Pennsylvania, January 30th through February 1st, 2026, where I'll be speaking. I'll be doing a breakout session on FASD, as well as a table of our resources, including my book. And then on February 21st, I will be at the church at Brook Hills in Birmingham, Alabama, where I will be doing a longer presentation on FASD, about 3-4 hours worth of content. And then in March, I will be at Mobilize, Ohio, March 21st to be exact, at North Canton Chapel, where I will be leading 3 breakout sessions there. And then I'll be in North Carolina, Swansboro, North Carolina, April 30th through May 2nd. That is the Renew Retreat, which is a retreat for foster and adoptive parents. So moms and dads can get away near the ocean for a few days. It's an incredible opportunity. I know one of the keynote speakers that is going to be there is Jackson Turkhurst, who we interviewed, I think back in the spring or early summer on this podcast. And he has an incredible story. He is a keynote there. I will be doing a couple breakout sessions. So I hope that you'll be able to get out to at least one of these events. And if you do, please find me, stop by my table so we can take a selfie and chat. And there are links, I believe, now to everything that you can register for in the show notes. So that'll make it easy for you to find. And if you're interested in having me come to your event, you can also reach out to me. My email address is also in the show notes. I personally answer my emails and will respond to you. So if you're looking for an in-person, or even if you have a group and you want to do a group training on FASD, I'm happy to do that. If you're doing a retreat for foster and adoptive parents or moms, I'm happy to do that. So reach out to me if you would like to talk further about that. So let's get to our guest and this amazing topic. We are going to be talking about nutrition all month long and how it pertains to and how important it is when it comes to our kids who've experienced trauma, prenatal exposure, ADHD, autism, all of the things. Today we're going to focus on FASD. So we have our returning favorite doctor, Dr. Jerrod Brown, with us to unpack, you know, for us foster and adoptive parents, this topic of nutrition as it pertains to FASD. And just so you know a little bit about Dr. Jerrod Brown, if you don't already know, he has 5 PhDs and specializes in topics related to autism, fetal alcohol spectrum disorder, confabulation, suggestibility, trauma and other life adversities, alexithymia, executive dysfunction, criminal recidivism, traumatic brain injury, youth fire setting. Oh my goodness, all of the things. He is just a wealth of information that he brings to us. And you can, like I said, you can check out his full bio on our website, where we also have a whole catalog of probably a couple dozen at least podcast episodes that we have done with Dr. Brown over the years. And they're all right there, easy for you to access. So if you are new to this podcast and you like what you hear today, there's a lot more, many, many more conversations with Dr. Jerrod Brown. So before I just keep prattling on, let's dive right in. So please welcome back to the show, Dr. Jerrod Brown. Welcome back, Dr. Brown.
Sandra, Merry Christmas a few days after. How you doing?
Yes. Merry Christmas, Happy New Year, all of the things. Doing great. So excited to have you back to keep going on this topic of nutrition. And then, today we're going to be focusing on FASD. And I reminded our listeners at the top that if they want to see your slides, they can go to our YouTube channel. And we put a link in the show notes to that. But other than that, I'm happy to hand it off to you to dive into this topic.
Great. Well, thank you, Sandra. Thank you, everyone. So this is part 2 of our 4-part series. Part 1 we did on trauma and attachment related problems and what that kind of indicates about feeding and diet and nutrition practices. And today we're going to talk about what the research says about this within the context of fetal alcohol spectrum disorder. On this first slide, you'll see my email. Reach out anytime if you have questions. And everything we're presenting in this series, we're not giving medical advice. We're not giving nutritional advice. We're just kind of pointing out what the research literature indicates. Here's a copy of my brief professional biography. If you've never heard me do a talk for Sandra's group before, I'm a professor, trainer, researcher, and consultant. I do a ton of work in the area of autism and FASD and trauma, doing more and more work now in the area of nutrition because one of my master's degrees is in applied clinical nutrition. And these are a handful of my different certifications and other credentials. I am a certified functional nutrition counselor, but again, licensure certifications, very, very different. And I'm not giving any specific advice today. So as we get into FASD, I think we all have a pretty good idea of what fetal alcohol spectrum disorder is, but I think it's important to point out some of the basics as to why a very high percentage of children teenagers and adults with FASD do struggle with different aspects of eating and feeding and diet and things of that nature. These are just a few of the primary disabilities that are associated with FASD. And again, if you're raising a child or teenager or adult with FASD, everybody's different. Maybe not all of this would apply directly to your loved one, but it is very important to know that everybody, without a doubt, who has FASD is going to have executive function impairments. That's a big topic we're going to talk about today. Memory problems are very common. Language deficits are very, very common. Most people with FASD look like they have ADHD. Is it full-blown ADHD? Maybe, maybe not. But attention and hyperactivity issues are very common as well. So hold on to that. We're going to talk about why we need to understand those topics. This is complicated. I'm often asked, I've given countless talks on FASD to different groups around the country on various aspects. And a lot of times the question comes up, well, what are the factors that impact the outcomes of prenatal alcohol exposure? It's not just what mom drank during pregnancy. What happens if mom was dealing with a ton of stress? Maybe she wasn't eating properly, or she was dealing with malnutrition on top of drinking alcohol. All of these factors can intensify the level of severity that child was exposed to in utero, which then can partially explain why some children with FASD may have more challenges than other children. So these are just some of the variables, not all of them, but these are some big ones you'd want to be aware of. The research says as many as 90 to 95% of people with FASD have co-occurring medical and or psychiatric issues. I think that number's low. Sandra, I'd love to hear your thoughts on that. I have never encountered somebody with FASD, or I've never worked on a case where the person had FASD where they did not have a whole host of co-occurring conditions. And these are some of the more common ones that are noted in the literature. By no means am I saying everyone with FASD is going to have conduct disorder. Absolutely not. But it is a comorbidity that's elevated. A lot of people with FASD actually have autism. I've consulted on many cases where the person has FASD and autism. And as you can see, there's many, many more things. But Sandra, I'll stop there. I know you have lots of insights as well.
Yeah, I don't know if I've heard the 90 to 95% of people with FASD have a co-concurring condition, but I absolutely it totally resonates with me. I've always heard that there are about 428 co-concurring conditions that are highly prevalent among the population of people with FASD. And I know you've got on the screen here, various things, the ADHD and the learning disabilities and things like that listed. And then there's other, and I don't know, maybe you have it on another slide, so I don't want to jump ahead, but there's other things like, the autoimmune conditions and, vision problems and, musculoskeletal conditions and so many different, it's a brain and body disability.
Couldn't have said it any better. Yes, to all of that for sure.
Yeah.
Internalized symptoms are things that the person experiences inwardly, and in some cases, maybe to the caregiver or professional, it might be a little more tricky to detect these on face value. Depression, forgetfulness, low energy, confusion, lack of persistence. Externalizing symptoms are things that we can see pretty easily. And I'm not saying everyone with FASD is going to have these things go on, but a lot of people with FASD, according to the research, do. So more non-compliant behavior, not following rules, mood swings, lying and stealing are elevated in this population. I mean, no disrespect, but that's what the research says. I see it all the time in cases I consult on. A good chunk of folks with FASD end up abusing substances as they get older, tobacco, alcohol, and drugs. A good chunk engage in inappropriate sexual behavior as they get older. I've consulted on many cases. And you have older research in the FASD literature that says as many as 60% of people with FASD at some point in their life come into contact with the justice system. I'm skewed because all the cases I pretty much consult on are justice involved situations. I know there's probably countless examples where somebody has FASD who doesn't engage in criminal behavior, but we need to be aware of that. So executive dysfunction, hallmark deficit of FASD. This is the boss of the brain, CEO of the brain. It relates to working memory, cognitive flexibility problems, disinhibition, which is more impulse control problems, abstract reasoning deficits, problems connecting the dots. This is one variable why eating related problems are high in this population, only one piece of the puzzle. Self-regulation problems. I see this all the time on cases I consult on. The person really struggles with having an internal parking brake to kind of slow down and pause. And if we equate this to food, in some cases, the person just overeats. They drink tons of energy drinks in some cases. They love sugar, and who doesn't love sugar? But if you have profound self-regulation problems, this really takes it to that next level. And obesity is higher in this population. I'm not aware of studies on this. I could be wrong, but anecdotally, I see a lot of type 2 diabetes in cases I consult on involving someone with FASD, especially in adults. And part of the reason is self-regulation problems around very poor eating habits over a very long period of time, years and decades. Here's some other factors we need to take into account, and this is all from the research. Research says folks with FASD may be dealing with higher rates of obesity. I've consulted on cases where that has not been the case. I see it go the other way sometimes too, where the person is underweight. And in this research, it does say that folks with FASD as a whole seem to have higher consumptions of sugar, inadequate amounts of micronutrients, constipation is higher, and patterns of disordered eating. So part of a holistic and integrative wellness treatment goal plan, providers really need to take these things into account. Because if somebody is constipated and they don't consider that during the treatment process, constipation in and of itself can trigger more mood instability problems, sleep issues, anxiety, irritability, depression. Here's a little bit about what the research says about disordered eating problems. There's not a ton of research out there on FASD and disordered eating. There is plenty that we can learn from. But why are we doing this 4-part series? Because if we can really understand this literature within the context of trauma and attachment, ADHD and autism, it's only going to help us better understand what is going on here, because there's tons of literature on autism and eating and tons of literature on ADHD and eating. I think we can borrow from that research and learn from it, and then have researchers do more digging into these variables as it applies to folks with FASD. So in the FASD literature, as it is related to eating behaviors, it does talk about having maladaptive appetites, maybe overeating, undereating. When that's the case, well, in my brain, it goes back to prenatal alcohol exposure. It was parts of the brain that are related to appetites and hormones and hunger cues damaged. The answer to that is probably absolutely yes. Picky eating has been noted to be more common in stress eating, to name a few. Here's an interesting article that it's a smaller article, but it does talk about folks with FASD in this one study seem to have higher levels of consumptions of sugar. Why do you want to care about sugar? Well, excessive sugar consumption is a threat to our brain health and body health. Here's another article that just talks about this within the context of infants. And this is an interesting thing. I think if you are an adoptive parent, a foster care parent, you have a baby that's placed with you, confirmed or suspected FASD, very, very important to work with a feeding specialist right away, because there's a lot of different variables we need to take into account. And this is one of the variables. Reduced suckle. They might have a reduced ability to transition to solid foods as they get a little bit older because of the damage that was caused to their brain from prenatal alcohol exposure. It gets very complex here. Weight gain, weight loss is one of the variables we need to take into account. So this study here talked about growth deficiencies, and this could be a factor with obesity and underweight status. And if we're talking about this, being underweight is a threat to human health, and being overweight can be a threat to human health. So part of a comprehensive integrative plan is to really take into account weight status. And the results from this particular study suggest that FASD may be characterized by disruptions of our metabolism and our endocrine system. It just gets very, very complicated. And Sandra, you alluded to this before. FASD, prenatal alcohol exposure, doesn't just impact the brain, it impacts the entire body. Food addiction has been noted to be a variable in some instances. And we also need to take into account food insecurity. Food insecurity is a real problem in this country, and it may be even higher in some families where you're raising children who have special needs, because of the costs associated with that and a whole bunch of other variables and factors to take into account. If we look at this again, going back to what does the research say about obesity and prenatal alcohol exposure? What are some of the factors we need to take into account? Well, certain medications could be a factor. I'm not saying go on certain medications or go off of them, but really working with providers and knowing what kind of medications the person's on. Dietary factors, of course, what we eat has a lot to do with it, but then also behavioral factors. What is going on with that child or that entire family system behaviorally? Is everybody stressed out? Is everybody angry? Are they irritable? Is nobody sleeping? Are parents just so checked out they don't have the energy to cook well-rounded meals, and they just get fast food all the time and order out pizza, things like that? Some families are just trying to survive day to day. The stress is real. The stress is high. Sandra, you mentioned this before about the immune system. Well, there's plenty of articles in the FASD literature that do talk about prenatal alcohol exposure may adversely impact the individual's immune system. And what does this research say? Well, you want to rule out other forms of prenatal traumas, well, not just alcohol, but whether drugs, tobacco, other forms of, maybe mom was going through a ton of trauma. Was mom sleep deprived through pregnancy? Are there some glucose metabolism abnormalities, so problems with the body being able to process glucose and use insulin appropriately? In this research, it says, yes, we want to look at that. What about premature birth? Children who are born extremely premature, that may be a contributing factor. Prolonged sedentary behaviors, excessive screen time exposure, we can definitely make a dent on this. If a child is glued to that screen hours and hours a day, it may actually hurt their immune system. So reducing screen time exposure. I've done an episode for Sandra on this very topic here, the HPA axis. Research says in the FASD literature, HPA axis dysfunction is very, very common. This is the hypothalamus pituitary adrenal axis. That is our body's main stress response system. and it is a hormone regulator. The gut-brain axis, dysfunction in that is alive and well, unfortunately, and attachment problems. So as you can see here, there's a big puzzle. It's not just one variable to take into account. We do need to be aware that malnutrition is a factor in some of these cases, so working with qualified providers to really be aware of this, target this. And this, my gut tells me this is probably something you'd really want to be aware of. If you're an adoptive foster care parent and you know that child just came out of a really horrific situation and was placed with you in your loving home. Maybe that child came out of a situation where they were malnourished. So really being aware of this topic is going to be very, very helpful. This is a good article that talks about what are some of the contributing factors to malnutrition in general. Well, there's a lot of things going on here, but these are some variables to consider. 10 different variables. Again, this is an international study, but I think we can learn from this. And if you're working with qualified providers, they're going to understand these things. But as you can see here, another big puzzle piece. This is not all the pieces of the puzzle, but these are some big ones you'd want to consider when trying to learn about what are the contributing factors to potential malnutrition. Sandra, I'll stop there before we move into our next section today.
Yeah, this is amazing. And it always is when we have a conversation with you, Dr. Brown, and I'm taking some notes. But in just some things that, kind of popped up in my mind with, when we consider we have primarily foster and adoptive parents who are listening. So our kids came to us, whether they came to us at, we were there and able to cut the cord in the delivery room, or they came at, any age thereafter. I think a lot of times when I'm hearing, you speak on these things, I think about maternal stress, and how, maternal stress and the impact that has on the developing baby. I think about when you're talking about malnutrition. There's a lot of things going on in the life of a birth mom, where, then her children are placed in care, or she's placing a baby for adoption, right? A lot of things going on, and it affects the baby. It affects development. It affects their brain and their body, especially if there's been prenatal exposure to alcohol and other substances.
Definitely. So you kind of summed it up. There's so many variables we need to think about. It's not just the prenatal alcohol exposure. In an ideal world, it would be great to know what maternal mom was doing during pregnancy. And we know, unfortunately, some of those records will not be available. But what I'm presenting in here in this 4-part series are some of the big variables I think we'd always want to dig into and be curious about that could help better explain what's going on with your child now, and then work with providers who can maybe target some of these areas with intervention. So this next section, it just tips, strategy, solutions. I'm assuming we have some professionals listening to this as well. Unfortunately, we know when a child has FASD, we're probably going to see more problematic behaviors pop up from time to time, or in some cases very frequently. When this happens, look at all the things that could be driving the bus here. Constipation could be one. Circadian rhythm misalignment. Blood sugar dysregulation. Dehydration. So when you see problematic behaviors, take a step back, stay curious. There could be all kinds of drivers for it, including everything on this particular slide and many, many more. What happens if the person's just hungry, or they're extremely tired, but they can't verbalize that to you, but then they become very irritable and irrational in their thinking? Sensory overload could be a factor as well. Most folks with FASD, if not all, are going to probably have some level of metacognitive based impairments, which is a type of executive function impairment. And all of these things I'm pointing out to you guys would be things I think if you're working with a feeding specialist, a dietitian, nutritionist, it would probably help them to understand these topics. It'll help them be more effective, I think, in developing an individualized kind of dietary feeding intervention plan for that child, teenager, or adult with FASD. So if somebody has metacognitive impairments, you'll find plenty of literature that talks about this could be a driver for problematic drinking patterns, problematic dietary patterns, and a whole host of other things. Response inhibition is a component of executive function. It's basically self-control deficit, self-regulation. Again, just want to introduce you to this term. And this is a big driver again for problematic eating patterns in this population. So sensory overload, maybe that child's got too much food on their plate and their brain is just overwhelmed. Simplify things. Maybe the child has olfactory sensitivity, which basically means maybe the food you're making smells fantastic, wonderful to you, but for someone with sensory issues, that aroma of that food could be very overwhelming and very triggering. So I'm not saying that's going on for you, but it is a variable to take into account. Abstract reasoning deficits, very, very common. This is so important when teaching an intervention or skill to anybody with FASD, regardless of what it is. When somebody has abstract reasoning deficits, lack of insight can impact decision making. It really gets in the way of connecting the dots. And if you equate this to eating, somebody that has this, they're not going to connect the dots that, having energy drinks all day long and sugar sweetened beverages and fast food and all of these things may catch up to me. And it may not be good for my brain and body. Connecting the dots there can be really, really tricky. When you're teaching a cooking skills, you're teaching eating behaviors, that really is an adaptive behavior. So if you're working with a qualified specialist, it's important for them to realize that folks with FASD have profound deficits in adaptive behavior, even though maybe in a controlled setting, they look like they're very competent. Maybe their IQ scores look pretty normal or just a little below normal, but their adaptive functioning, how they take care of their own self-care. Can they stay motivated? Do they know how to cook and clean and keep their room organized without help? I'm not saying you're a parent there and you're giving them nudges. This is basically how they do it without you prompting them and reminding them. Profound deficits in this area. So again, this kind of sums it up again, why we need to be aware of all of these topics holistically. It's not just the prenatal alcohol exposure, other forms of trauma, adverse childhood experiences, poverty, homelessness. Maybe there were multiple placements before that child came to you. And the more placements that child has had, I'm sure there's been different routines and different rules around eating practices. So it can be very, very, very tricky. So I mentioned the hyperactivity before. This is very common among folks with FASD, and I do believe, this is my own opinion, diet does play a big role here, especially if we're talking about a child who has a ton of sugar, a ton of caffeine, a ton of food that's loaded with preservatives and dyes. I'm not saying take your kids off those foods, but talk to a nutritionist, dietitian, and really consider, could the food that child's eating amplify this? I'm not saying it's the only variable, but it is a variable that we can control, and it hopefully can calm down the brain and body enough where then you can teach interventions that will stick. This is to everybody. This isn't just FASD, but what are some of the factors associated with poor diet quality? Well, maybe there's some lack of planning skills. Maybe that family lacks the knowledge about nutrition. Do they lack the skills necessary to go to the store and select what is healthy versus unhealthy food? And then do they have the skills to prepare healthy meals? In an ideal world, it'd be phenomenal, I think, for families raising a child with FASD to do a cooking class together. I'm not aware of any FASD literature that's looked at that, but I am aware of plenty of studies that have looked at that within the context of autism. And there's some good studies that show parents who have a child with autism and they take a cooking class together with their child, that leads to better eating outcomes. What are the barriers to eating healthy food in general? This is just to anybody again. Could there be social pressures? Maybe in your home you do a great job, but then when that child goes to school or goes to a birthday party or a friend's house, all bets are off. And then that child eats food that maybe you don't agree with, but you don't want to be looked at as the parent who doesn't allow that child to have like birthday cake, which is very difficult and stuff. And then the child comes back to your home very dysregulated and won't eat your healthy food. I hear that sometimes. Habits, looking at problematic habits. Maybe there's lack of ability or availability for healthy foods. So this could be an issue with food insecurity as well. And what does the general research say about why it's so difficult to change eating behaviors just in general for anybody? And I do think when we're talking about children with a neurodevelopmental disorder, this gets even more challenging. So this is what the general research literature says about what are some of those behaviors, factors that really get in the way of changing eating behaviors from unhealthy to healthy. So as you can see here, there's a lot of them, but there's a lot of things we can do about that, which we'll talk about in a few minutes. Be aware, lots and lots of stress in your family system can lead to stress eating, consuming higher energy portions. So maybe you're dealing with tons of stress, you're not sleeping good, you wake up in the middle of the night. What do you go to? A bowl of ice cream, some cake, some cookies. Hey, that may help for a few minutes, but that does not help in the long run. Then your body becomes inflamed and that can trigger anxiety, and it's a vicious cycle. So in the research literature, like if you look at the general nutrition science literature, there's some controversy in there about, is food truly addictive? My own personal beliefs, I absolutely believe food is addictive. I have family members that clearly are addicted to sugar. There's no doubt in my mind. But in the research, it says these are some of the foods identified as maybe having potential addictive tendencies. Look at all these wonderful tasting foods. Now, however, pretty much all these foods are not good for our brain, but this is the way a lot of people eat in this country. And these are foods that would fall under the umbrella of the Western diet. Why do we want to care about stress, chronic stress within this talk? Well, chronic stress, as you can see, leads to all kinds of problematic outcomes, including craving more sugary, salty foods. It can throw off our immune system, our gut health, our sleep. So any family who's dealing with tons of chronic stress would do well trying to get that stress down, working with other people and other providers. When we talk about stress, if somebody's going through a ton of stress, that can lead to HPA axis dysfunction, which then can trickle down into having more poor eating problems. It's all interconnected. So in the FASD literature, as I mentioned before, prenatal alcohol exposure actually can lead to HPA axis dysfunction. This is a big variable as to why I think poor eating problems are more common in this population. When the HPA axis is dysregulated, this is what the general literature says. It can lead to more sleep problems. It can have an impact on our memory. We feel more irritable. Basically, in a nutshell, this is going to feel like symptoms of burnout. Maybe some of you have heard like adrenal fatigue. It's really HPA axis fatigue, in my opinion. And you just don't feel good. You're burnt out, you're tense, your energy's not good, your motivation's lower. It's not a good situation, but the more we can learn about this topic, then we can do things to make it better. multitude of causes for HPA axis dysfunction, the over-reliance on processed foods, living in a homeless shelter. There's studies on that. Over-exercising, under-exercising, being the victim of domestic violence or any kind of trauma, chronic loneliness, if that child's being bullied and teased, certain infections, digestive health issues, and the list goes on. Another variable here is alexithymia. Very common for folks with autism to have this. 50% of people with autism have this. In the FASD world, I've never come across a study that's looked at this specifically in the FASD literature, but in the FASD literature, the term alexithymia does pop up once in a while. This is when somebody is going to have a hard time naming, labeling, processing emotions. And when that's the case, all that energy goes into their body, and then they might have more anxiety and depression and stress, which then contributes to them craving more unhealthy foods to cope with that, which it does help them bring down the anxiety, depression, and stress probably. If you have a bowl of ice cream, it probably makes you feel better, but it probably only makes you feel better for just a very short period of time. And then these symptoms come flooding back, and then you want more, and it's a vicious cycle. So alexithymia, problems with emotional clarity, problems with emotional awareness, problems communicating your emotions effectively, more emotional suppression. So this can cause headaches, migraine, gut health issues, chest pain. The child may say, I can't catch my breath. This could all be symptoms of alexithymia. I think it's very, very high among people with FASD, in my opinion. Here's another variable to consider when we look at this big puzzle is choice-making deficits. Maybe that child, teenager, adult with FASD just really struggles making good choices around food or whatever it is. These are the big puzzle pieces involved in what you should dig into and work with a provider on if your child has a lot of choice-making deficits. They likely probably have deficits in a lot of these areas, and these would be all areas to screen for and target with intervention. And why do we want to care about choice-making deficits? Well, it can lead to learned helplessness, poor self-awareness, low self-esteem. Low self-esteem is a trigger for more problematic eating patterns, the research literature says as well. And as that person gets older, if they struggle with making good choices repeatedly, that may impact the ability to find a job and keep a job. It can, without a doubt, contribute to lower levels of quality of life. It can get in the way of appropriate independent living. Personal functioning, this is where I would say the cooking skills come into play. And decreasing inappropriate behavior when we have good choice making. When we have poor choice making, this could be a factor for why that child, teenager, or adult in some cases came into contact with the justice system.
Sandra Flach, host of the Adoption and Foster Care Journey podcast, and FASD educator Debbie Raymond invite you to join Hope for the FASD Journey, a virtual support community for parents and caregivers raising individuals with fetal alcohol spectrum disorder, diagnosed or not. This faith-based support community meets online 3 times each month, features special VIP guests, and a private Facebook group for members only, which includes Soul Care Saturday video devotionals led by Sandra and Deb. Both Sandra and Deb are adoptive moms raising kids with FASD and facilitators of the Facets neurobehavioral model. For details and to register, visit justicefororphansny.org/hope-community. That's justicefororphansny.org/hope-community.
Oh, goodness. Well, I do want to mention, so our listeners are aware, when they go to our website for the bonus episodes that we've done with Dr. Brown, we did entire episodes focusing on HPA access, alexithymia, metacognition, executive dysfunction. There's so many episodes that just focus on, each topic like that. So if this is piquing your interest, you want to go there so you can listen to those. But beyond that, I know some of the things you were talking, you're listing off all those foods, and I keep thinking comfort foods, right? When any of us is stressed, it's likely we're gonna choose a comfort food, right? And so it's understandable with our kids because there's a lot of stress and anxiety among the population of people with FASD. It makes sense that they're wanting those comfort foods as well. But then, is there a connection, Dr. Brown? Because I've always heard that an individual with FASD, because they were exposed to alcohol in utero, and that breaks down to a sugar. That's the reason why there's a lot of sugar craving among this population. Have you found that in the literature?
I hear that come up from time to time. It could be a layer, the way maybe the sugars metabolize the glucose in the brain. It's not going to be the only factor, but it would be a factor, I think, to look into and maybe work with providers in terms of really monitoring glucose levels and how that person's brain actually processes and uses glucose in their brain and body. And glucose is metabolic fuel. It's the fuel of our brain. We need proper levels of glucose to function and think and live.
Yeah, it makes so much sense to me. And we just came off of the holidays, right? So I think, we probably have, kind of glaring examples right now from surviving the month of December where there's an increased, amount of the junk food, right? An increased amount of sugary desserts and Christmas cookies and all of that. And then also probably parents are noticing an increase in hyperactive behavior or problematic behavior. It kind of exacerbates all of the symptoms that we're already struggling with, that are symptoms of FASD. I feel like this was like we just lived through a perfect example of how nutrition does affect, the bodies and the brains of our kids and the behaviors.
Look at the gut-brain axis and then also consider how it affects sleep health. And this is a slide just to be aware of. And a very high percentage of people with FASD don't sleep that well.
Mhm.
What are the general dietary patterns and habits that may exacerbate insomnia for any one of us? Well, taking a look at this, having too much candy, energy drinks, not having enough fruits and vegetables, sugar sweetened beverages, not good, having low levels of zinc, vitamin C, fiber, breakfast skipping. These are all things that impact our sleep health as well. Junk food consumption. This is not an FASD specific study. This is just for adolescents in general. Some studies have found that the overconsumption of junk food among adolescents may trigger more depression, more behavioral problems, more hyperactivity issues, and more fatigue. This last section, just tips, strategies, solutions, interventions. Again, talk to your healthcare provider before implementing this. Share this with your healthcare provider if you feel like it's helpful. When we are working on helping people with FASD improve overall health and wellness and functioning, I'm convinced, and it's supported in the literature, we need a team approach. Not one of us can do it together. This is one article of many that talks about we need to work with all kinds of different disciplines. And this is a small snapshot. Psychiatry, neurology, cardiology, nutrition, social workers, speech language pathologists, occupational therapists, in-home skills workers, sleep specialists, the list goes on. When you want to teach a new skill to someone with FASD or any other type of neurodevelopmental disorder around any cooking or eating healthier, we got to take small steps. It's got to be developmentally appropriate. We got to stay patient. We got to teach the skill in multiple settings. Role playing. I do believe, my gut tells me, I don't have any research to back this up with FASD. Lego-based interventions might be a great way to teach some of these skills. I'm giving several talks in 2026 to different groups about the use of Lego therapy and Lego interventions for people with autism and brain injuries in general. I do have one slide in there about FASD. I do think it's an area to look into. This is what the research says in a nutshell when we're talking about what are the critical steps needed to achieve long-term success. If you know your child, teenager, or adult with FASD has difficulty in any one of these areas, it's probably a barrier that gets in the way of that person being successful over the long term. So the more we can understand these pieces of the puzzle, target them with intervention and strengthen them, any kind of thing you teach that person should lead to better outcomes. We need to have an executive function informed lens when working with folks with FASD. These are strategies aimed at improving executive function. Self-monitoring strategies, using visual calendars, teaching that person how to live a healthy life, good sleep, nutrition, managing stress, using checklist, planners, staying more organized. These are all very concrete skills that can help improve executive function. These are some metacognitive strategies, which are very similar to the last slide I showed you. We talked about metacognitive deficits, very common. What do we do about it? Well, I think it's common sense. Coaching, modeling, teaching, role playing, empowerment. We got to be very empowering. We got to build up self-esteem. We got to look at this through the long game. This is not something that's going to clear up by going to an 8-week treatment program or going to a therapist once a week. This is a lifelong neurodevelopmental disorder. These are things we're going to have to reinforce and do over and over again. How do we strengthen abstract reasoning? Well, this is a few things to consider. Breaking down complicated tasks into step-by-step directions. And that is good, but I'm guilty of this too. You can break it down and you can list all these wonderful steps on a piece of paper. But what happens if there's 10 steps on that piece of paper? That's overwhelming. Maybe you break it down step by step, but you only have 1 or 2 steps that you tackle each day on the paper. So we want to be aware of sensory overload. Playing make-believe could be a way to improve abstract reasoning. This is where it gets a little tricky because of fantasy proneness, confabulation in this population. So you play make-believe, you might be creating a false memory that person starts believing. So this does get a little more tricky. How do we improve self-regulation skills? How do we teach that person how to pause, reflect, and be a little more patient? Well, everything I just said before in the last few slides can be very, very helpful. Give very concrete examples and instructions. Allow opportunities to practice what you've learned. So you teach the skill in a therapy office, they have to have opportunities to practice it at school or at home and vice versa. You got to practice it in multiple settings. Modeling delayed gratification. Maybe going to YouTube and pulling up a video on the marshmallow test and just showing that it's a cute little test. It's a great way to teach delayed gratification. The more we can become organized. I hear this all the time from cases I've consulted on involving someone with FASD. They struggle to stay organized and keep their room clean. Doing things concretely and helping improve organizational skills can be a good way too to help live a healthier lifestyle. Time management could be a factor in this big puzzle we're talking about. If that family struggles with time management and you're rushing and rushing and rushing, are you skipping meals? Do you never sit down as a family to eat? Are you always on the go? And maybe if you're always on the go, do you stop at the gas station quick to get your child a quick meal you warm up in the microwave for 2 minutes? Or you go through the drive-through? That is a variable we need to consider as time management. I do a lot of work in the area of lifestyle medicine. I have a certification in this. I've given a lot of talks on this. lifestyle medicine approaches have been applied to so many populations. I don't know why we can't apply it to the FASD world. Lifestyle medicine is all about preventative kinds of interventions, coaching, stress management, education, self-care. Coaching approaches. In the coaching literature, there's an approach to coaching called strengths-based coaching. I think this could be applied very nicely to the FASD world. Coaching approaches, I think, are way better than insight-based therapeutic approaches. And if you tack on strengths-based to coaching, what does that mean? Well, we're more encouraging, we're more motivating. We're using trauma-informed care, we're utilizing motivational interviewing. These can be very helpful for anybody. In the FASD world, there's some studies that talk about some family-focused interventions, and this is all common sense, but family-focused interventions that have been shown to be most helpful for raising a child with FASD is really focusing on stability in a nurturing home environment, keeping things calm, really promoting attachment, working on promoting positive parent-child interactions. This can be stressful when that child's not sleeping, when the child's not eating, or maybe they're doing a lot of food refusal. Working with parents on promoting self-efficacy. Maybe the parents are doing really well in a lot of areas, but maybe they would do well getting some nutrition education as well. And whatever we can do to reduce parental stress as well. Mindful eating is a practice used if that child went to like a nutritionist, dietitian. A lot of those folks are trained in this, but mindful eating, just learning how to slow down. I don't know if you see this, folks, but I've seen this on cases I consult on. A lot of clients rush through eating. They just eat. Their brains don't have time to like slow down and, well, maybe I'm full. Maybe having a fifth plate of food at the buffet is probably not a good idea. Practicing mindfulness, staying in the moment, this can be helpful as part of mindful eating.
Yeah, and also I'll just jump in real quick.
Yeah,
It made me
please.
think of, especially with kids or teens eating while they're playing video games or while they're scrolling on their phone or watching TV. We're not really paying attention to what we're eating or how much we're eating in those instances.
There's a direct connection between excessive screen time exposure and problematic eating patterns, the general research says. I mentioned sugar sweetened beverages, energy drinks a little bit today. This is what the intervention literature says about helping people cut down or quit sugar sweetened beverages. Well, you provide psychoeducation. You learn about metacognitive training. You consult with a dietitian nutritionist. You focus on optimism, gratitude, positive psychological interventions. We do everything we can to boost self-esteem. We reduce screen time exposure, ties in directly what you just said, Sandra. Caregiver education. I grew up, my dad would drink diet sodas like it was going out of style. I didn't think anything of it. He modeled that to me. What did I do? I drank lots of soda growing up. Looking back on it, if my dad would have known, maybe that would have done something different. A lot of times we just don't think about it because we don't have the education. You always hear me talk about this in many of the episodes we do together. This is an intervention. Eat as a family, sit down. It can be very, very helpful. And this is what some of the research says about sharing meals together as a family and being disconnected from technology. It promotes happiness. It promotes feelings of contentment and security. It helps promote positive communication and listening abilities in that child. It's a great way to promote empathy and perspective taking. It can help reduce conflict in that family, and it can promote better eating habits. Self-compassion is a great intervention for parents to use and then model that to kids. The more you're nice to yourself, it has been shown you're more likely to exercise, eat better, and get better sleep. And these are some just general, potentially promising practices you'll find in the FASD literature. And again, most of these are very common sense: consistency, structure, predictability, maybe working with a mentor, a coach, a teacher, a pastor, whoever. You compensate for other brain-based deficits. So the more you can learn about some of those things we spoke about today, we're going to be in a better position. Teach the skills in multiple settings. So you're teaching how to generalize the skill learned in one setting and apply it to the other. We want to individualize our approaches because everyone with FASD has different experiences. And we want to make sure these supports are long-term. Sandra, I'll stop there now. Here, thanks, folks. Sandra, thanks for having me back. Here's my email address again if folks have any questions.
Yes, absolutely. Thank you so much, Dr. Brown. Again, a wealth of information. Our listeners can go to YouTube to be able to see the slides that you've been sharing, because there's a lot more information on them than just what Dr. Brown spoke, and along with his email. And we will be back next week where we will focus on nutrition and ADHD, I believe.
Correct.
Perfect. Thank you so much again, Dr. Brown, for being with us today.
You're welcome, my friend. Thank you.
Wow, another amazing episode with Dr. Brown. I can't wait to go back again and listen myself. And there's just so much, a lot to take in, a lot to process. He said lots of things. One of the things he did mention, and I made a note because I think we'll get another guest on when we're finished with this series, but I met an adoptive dad at a conference this fall, and his son has FASD. His son is young, and they started doing a cooking show together. I believe the dad is a chef professionally. So at home, they're preparing simple meals together, and they're showing it like a cooking show style on YouTube. And I think they're also on social media, like on Facebook and Instagram. And I believe they're called Red Shoes Chefs. So Red Shoes, of course, is a nod to FASD, our symbol for FASD. So I may be able to get them on the show when we're done with our series with Dr. Brown, so we can talk about cooking with our kids. That might be a great one to tackle then. So, and again, next week we will be focusing on nutrition and ADHD. So I also want to thank you for listening today to this episode with Dr. Brown. Again, you can go to our website, justicefororphansny.org. There's a link in the show notes. And when you go there and you click on the adoption and foster care journey, you will find all of our resources as well as all of our episodes. There has to be more than 24 episodes, probably 36 by now, with just Dr. Brown. And you can go through and see what the topics are, and you can learn more and listen if you would like to do that. And also, don't forget to register to win a free signed copy of Soul Care Saturday, 52 Devotions for Foster and Adoptive Moms. Link in the show notes where you can register. And also, don't forget that I offer FASD online and in-person training. And I have several online trainings coming up that you can sign up for. They're not recorded. I do them live, so they're interactive. You can ask questions. Every month I offer one free Intro to FASD. It's just a basic 1 hour presentation about FASD. We do Q&A at the end, and that's great for anybody from a parent to a caregiver to a relative, school teacher, babysitter, youth group leader, Sunday school teacher, anybody working with your kiddo who really should have a better understanding of FASD and the brain. So those are great. I also offer a 3-hour workshop, usually once a month as well. It's online. Where we unpack the facets neurobehavioral model in those sessions, as well as coming up, I believe on February 19th, we're kicking off. The title of this workshop is called Wired Differently. It is a 5-session. They're 3 hours, once a week session, using the facets neurobehavioral model. So it's 15 hours worth of content. It's the most in-depth workshop that I do. I offer it usually in the spring and again in the fall. So if you're interested in I guess you could say the winter, we're going to start the end of February. So you will want to sign up right away for that to make sure that you get a spot there. And again, links in the show notes for all of the above, as well as how to sign up for our Hope for the FASD Journey online support community. And if you enjoy this show, share it with your fellow foster and adoptive parenting friends. Follow us on our social media. Make sure that you follow the podcast, download it so that you can, if you subscribe to it, you'll get the episode on your phone every week. We drop a new episode every Monday. Some podcasts, and I'm an avid podcast listener, some podcasts they're very sporadic or they'll take big breaks in between, and you get used to, you want your episode every week and then all of a sudden it's not there and it can be disappointing. We have a new episode every single week all year long. So we've got hundreds and hundreds of episodes cataloged for you, and we drop a new one every week. So make sure that you subscribe so you don't miss any of the new content. Be sure to follow us on social media and tune in next week where we have Dr. Brown back for our nutrition series. So again, I'm grateful to have you along for the journey.
Thank you for listening to this episode of the Adoption and Foster Care Journey podcast, brought to you by Justice for Orphans. We hope you were encouraged today. Please be sure to subscribe to this podcast and leave a review, and share it with your fellow foster and adoptive parent friends so they can be encouraged too. Be sure to find and follow us on Facebook and Instagram at Justice for Orphans, and check out our website for vital resources at justicefororphansny.org.